have, thank you, Lauren, for reminding for doing that. We have three amazing guests who are experts at different types of shared services here to kind of do a short presentation on how they do that and what they do, and then to open it up for questions and comments and things that you might be interested in to learn a little bit more about. Today we're dive last time during this conversation we really looked at an umbrella organization that has members that pay member fees to the umbrella organization, and one of the many things that they offer was healthcare benefits through a broker, and we had a conversation around how that broker relationship really works. This time we're switching to a little bit different. We're looking at a couple different models. We have Elizabeth Lundberg and Cheryl Gilbert here. Both of them have shared service providers here in the state of Vermont, different models. So it'll be exciting to hear how they do that, that offer services, back office support and operations to their members and to their clients. We then have Ellen Wang here from TSNE, who runs the shared service and fractional services part of TSNE's portfolio of work. And it's a very different model of how you might access some of these back office support services for your nonprofit. This is an opportunity for our community, our nonprofit community here across the state who are participating to ask questions, to dive in, to see if there's, other tools or things that you might want to know a little bit more about. So with that said, I'm going to offer the opportunity for our three panelists to just give a brief overview of who they are, about a little bit about their organization. I would love to hear a little bit about kind of the mechanics and the behind the scenes of how you share services and what that really means for you. And then we will open it up for questions and conversation afterward. Does that make sense, everybody? If you have questions that occur to you along the way and you don't want to forget, feel free to put them in the chat. We will start with the chat when we open it up for conversation. So don't lose track of your questions as folks are going forth. Sound good? All right. So I'm going to start with Cheryl Gilbert, who is from the Vermont Aging
Network
Network.
Consortium.
Thank you, Network Consortium. I have introduced her multiple times and have gotten the name incorrect, but I think what the work that she's doing is incredible. So I will start with Cheryl and just give you, 3 to 5 minutes to just give an overview of that work and the organ and the. Thank
Great.
you.
Thank you. So Vermont Aging Network Consortium, or VANC for short, is a network, a community care network of the 5 councils on aging in the state of Vermont. The VANC is set up to be a shared service model. We currently are building our infrastructure, working on those back office cost savings, pooled cost savings, building out shared services with our financial programs, our technology systems, and our various contracts. We intend to create more sustainability by bringing contracts through VANC, through single payers and such. Those contracts will be passed through VANC. We'll do all the administrative work, grants or contracts, and the councils on aging will do the program work. This is a very common model in the U.S. aging spectrum. And we've had huge success just in the last 18 months in finding pooled cost savings, really gearing up our staff to work with us and create these new technology processes and standardizations across the organizations. You're on mute, Sarah.
Yep. Just saw that. Thank you. Technology is my friend today. Thank you for that, Cheryl. That was a great overview. And thank you, Lauren, for putting into the chat. So folks that want to go in and just check out the website, Lauren has put that into the chat. So thank you. Elizabeth, thank you for joining us today. This is my first time working with Elizabeth, so I'm excited to hear a little bit more about Aris and how you work and the kind of the shared services that you provide. So thank you, Elizabeth. I'll let you provide just a little overview.
Yeah, thanks for having me here. Thanks for the invite. So Aris Solutions started in 1996, and the reason for that was because the developmental disability services were having their service, I guess, cut from the state of Vermont. The governor was decreasing the rate that they could provide services. So in order to help with that, two of the services got together and they decided that they would share their services. They would share their CFO, they would share their financial services, and kind of get together on the back end for the admin. And so from 1996 to current, we have added additional agencies and kind of gone back and forth. And where we are now is we have 5 developmental disability agencies or specialized service agencies that we work with, in addition to 1 self-advocacy agency. And we do all of their accounting, billing, payroll. We do the auditing. We also have back-end services that occasionally can include human resources, IT, legal. We're really their back-end office organization for them so that they don't have to worry about that aspect and they can really focus on the services that they need to provide to those in Vermont that need them. And we've, like I said, we've been here since 96, and we do think that the consolidation of these services works really well. We're able to do a lot with health insurance. Obviously, we use the same auditing firm. We use the same insurance organizations, so we can consolidate those services and it makes it a lot more efficient as well. And then we have a team here of probably 10 people that work on that, those services for the agencies, and they're all kind of assigned a different agency. So there's a lead person that they talk to. And our Aris CFO is also their acting CFO. So they are responsible. This one woman is, as a CFO, is responsible for all of their financial activity. And then she's got a team, like I said, underneath her to get the real work done. So I think it's a model that works really well. The executive directors that we work with have kind of formed their own collective group so that they can discuss issues. They can go through things that are, changes that are occurring in the state. And they actually now have kind of a sounding board, almost like a group of folks that are dealing with the same changes that they can kind of really discuss and throw things off of and determine what the best way forward is with what's occurring over the state. It's really kind of been a great team of people to work with. So that's kind of where we are. I don't know.
No, that was perfect. Thank you. Appreciate that. Thank you, Elizabeth. And I'm going to offer Ellen the opportunity to talk a little bit about TSNE. And thank you for showing up, and appreciate you coming at a very last minute opportunity. So thank you for coming, and would love to hear just how you're structured and kind of the services and supports that you provide.
Thank you so much for having me, Sarah, and apologies in advance. I'm getting over the flu, so sorry for my froggy voice. Would it be okay if I shared a brief presentation, Sarah? It's just a few minutes. Okay.
Yeah, see if you can, you should be able to share. Okay, perfect.
Okay. Thank you. All right, so again, thank you for having me. I am the interloper here. I don't know how many of you have heard about TSNE, formerly known as Third Sector New England. We are based in Boston. We're a 65-year-old organization, capacity building organization that partners with nonprofits to provide the services, programs, and resources that nonprofits need to support their communities and ultimately create a more equitable society. So we are a national organization. I think we're probably most well known for our fiscal sponsorship program. I run our shared services program, which just launched last year. We're the newest line of service at TSNE, and we also offer consulting and cohort learning, as well as executive search and nonprofit property services. So I think what we offer is actually probably pretty comparable to what some of my colleagues have just described. So we are basically providing administrative and operational support to small to mid-sized nonprofits, enabling folks to really focus on their mission-driven work while we help manage the back office supports. Again, we launched with payroll and accounting last year in August, and just recently launched our HR services. Here's just a little bit more information. I won't go into it too much, but in terms of financial services, we offer, the usual bookkeeping and accounting, as well as grants and finance management, and payroll as well. And we have a pretty specific focus, just based on, what we know of the landscape and the needs of nonprofits. How we define small to mid-sized nonprofits is as follows. And for this first year, what we've called our pilot year, we've really focused on organizations that are located in Massachusetts, but I'm excited to share in 2026, we will be expanding to New England. And, we're really interested and invested in working with organizations that are working towards justice and equity. And we also prioritize BIPOC-led and BIPOC-serving organizations, though we are not exclusive. I'll just share really quickly, in terms of HR services, we basically have two lines of service. One where it's, providing organizations that don't really have in-house HR capacity with ongoing support, as well as a more, one-time engagement. Maybe you need help on a particular project, like an employee handbook, something that we can complete within 6 months. So those are the kinds of HR services we offer. If you're interested in learning more, especially about when we will be expanding to Vermont and other New England states, please feel free to reach out to us. I'll also share these links in the chat. Thank you.
Great. Thank you so much. We will, a couple of things that I just observed in terms of kind of who and what, thinking about the different models shared. I mean, Elizabeth and Cheryl really shared kind of Vermont-focused organizations that are providing services to similar like organizations in their client and or membership. Whereas Ellen is presenting something that where you as individual organization can access some of these back office support services, right? And so they're a little bit different in their models, and how you as nonprofit here in the state of Vermont might be able to access or think about those types of sort of ways of sharing those back office services. The one thing that I thought was really interesting is all of you, while there's this kind of underlying idea that there's cost effectiveness or efficiencies in systems across, when you share, all of you talked about this allows for deeper impact in programming by kind of consolidating services behind the scenes and allowing people who are really expert at whatever their organization is providing to do that in a much more effective and efficient way and focused on that work that they do. I wonder, there's some questions I do see some questions in the chat. I wonder first, though, one of the questions I know that has come up in other conversations is around funding. Right? So I would start with kind of Elizabeth and Cheryl, like, how do you fund your organizations? And then I would turn to Ellen and just talk about kind of your fee structure and how one might access it through kind of financially. So I don't know, Elizabeth or Cheryl, if either one of you would like to just start and to talk a little bit about kind of how are you funded as an organization? Like Elizabeth, you said like 10 to 12 staff members. Like, what does that look like and what did it take to get there?
Well, I think when we started, it was just the two. So we had two of the organizations that kind of wanted to join services. And obviously, so they don't have to go out and hire their own CFO. There's two CFOs. There'd be two staff and payroll, potentially two HR directors, et cetera, et cetera. They combined resources and they decided to start this nonprofit. And then as we continued, we were adding additional agencies to our staff. So the money that they were saving, they would contract with us instead. So we have contracts, we have annual contracts with each of the agencies that we do this work for. And it's basically, we're trying to break even as much as we can. We're also a nonprofit. So we only try to charge them what we, just to cover our costs for the work that we're doing. And the contracts change a little bit from year to year based on the needs of the agency. But for the most part, they've been pretty static as far as the work that we deliver and what their needs are. And it really does include all of the office support. So that's typically how we do it. We also have, minor increases per year for COLA and, any health insurance obviously is going up significantly. So we just try to make sure that we get pretty close to that cost threshold. We try not to get too high or too low based on our own needs. And then of course the needs of the agencies. The work that they're doing is so important to the state of Vermont and the Vermonters that we don't want to overcharge, of course, for them, because what they need to be spending their money on providing services themselves. So, that's certainly, we want to be a low cost solution for them.
Great, thank you. So there's a membership fee that's kind of, or a percentage of cost, or a fee that's created based on the cost of providing those services?
Yeah, and over the years, we've been able to figure out what it will cost to break even. So if one year we're a little bit over, I mean, I don't know what you're talking about as a full, let's say it's a $500,000 contract, and maybe one year we're over by 5,000. I mean, the percentage is so low, and then maybe the next year we're under by 7,000. The next year we're over by $200. Like it's pretty close. We have been doing it long enough to know what the cost parameters are for us. I think if you're just starting, it might be a little bit more difficult to determine that. But essentially with anything, as a business analyst, you would have to sit down and you would have to draw up the budget and say, this is how many hours of work I think it's going to take, and the people involved that it's going to, we're going to need to provide the services, and then, kind of putting that on do the napkin math and figure out what that's going to cost your agency to get the work done.
Awesome. Thanks, Elizabeth.
Yeah.
I'll turn to Cheryl because I know you're starting this now. So talk a little bit about kind of how you've structured it and kind of contrast to what where Elizabeth is as somebody who's been fairly established.
Yeah, thank you. So VANC started about 18 months ago. So we have affiliation agreements. So the 5 AAAs are affiliates and they pay dues. They have those dues are established. There was a certain startup due that was put forth. And since then, the dues vary by how much savings I'm able to capture through contracts or with any pooled cost savings contracts that I might have with vendors. So that, again, that their dues really vary depending on where our costs are. Like Elizabeth, we really try to stay very close to the break-even point. We also have 2 very large grants from U.S. Aging and ACL. So we see that structure continuing where the dues will be lower depending on overall cost. We anticipate bringing in outside revenue sources that will be, we'll do the administrative work on the back end, and the AAAs will be doing the program work. So again, we'll have those same kind of contracts that they'll be doing the program work.
Great, thank you, Cheryl. And Ellen, I don't know if you would want to talk a little bit about your model's very different, so it would be great to kind of just hear how that is, how you think about financing and funding.
Absolutely. So TSNE is also a nonprofit. As I mentioned, we've been around for 65 years, and internally we have a team of around 90 people. So we are primarily a fee-for-service organization. And I can share that just this year, we also have hired and built an advancement team. And I'll be the first to acknowledge in Massachusetts, there are just, like in general, more philanthropic resources than perhaps in the northern tier. So I think, that's important to put out there. In terms of how we look at the rates for our shared services, we do a sliding scale. So the smaller your operating budget and expenses, again, we start at $350. The lower, it's a flat fee, but it's an overall percentage. And yeah, again, it's a sliding scale. And for the HR services, we look more at the number. We also look at your operating budget and the number of employees you have in your organization. I think one thing that's been interesting, in our first year is organizations reaching out to us who say, like, why won't you work with my organization if I'm under 350? Well, my thing is always, if your operating budget is under $350,000, I'm not sure that what we offer right now is necessarily the best use of your resources, right? Because what are other things that we or others could be doing to support you to maybe like bring you to a place where you might actually, be able to optimize what these services offer. So the 350 budget is not a hard and fast rule, but it's where just in our research, we've seen, where folks can start, maybe they're, bringing like an actual FTE on board. But last thing I'll share is our sweet spot for what we offer right now has been for organizations that have a budget around 750,000, a little under $1 million. Just from talking to folks, whether we're currently working with them or, done like different intake conversations with, that's sort of been where I think folks who are there, they find our services most useful at this point in the life cycle of their organization.
Thank you, Ellen. That was helpful. Just to kind of hear a little bit of the difference. I know that there's some questions. I'm going to just start with Sarah. Did you want to see that you had a question specifically for Elizabeth? I wondered if you wanted to just ask that question specific.
Yeah, actually, it's now a question for Elizabeth and Ellen. But yeah, I'm curious, as you price out these contracts, what does it represent for the participating organization? Is it a certain number of hours? Yeah, just curious about how you think that through. And I imagine perhaps it differs depending on whether it's finance or HR, but maybe not. So yeah, I'd love to hear more about that.
I think for us, I was halfway through typing my response. Maybe I should just delete it. But for us, it's not a set number of hours. I think at one point, a couple of years ago, we were talking about the contracts again, and I was talking to the executive directors and asking them if that would be better for them. Because we do kind of vary up and down year by year, whether they overpay or we end up, taking a hit. But I think they didn't want to have to say like, oh, if I call Aris, we're going to get charged for that, or how do we maintain that? That's just far too administratively difficult to do. And we want obviously to be able to respond to them whenever they need us. So again, for us, it's mostly just we've been in the business long enough to know what is, basically going to be needed. I think we're currently going to take a hit this year because the state of Vermont for the disability services has decided to put forth a payment reform system. And so our CFO has spent so many hours working on this. It's really, she doesn't get paid overtime, but we definitely have people here that have been needing to work overtime for that particular project. But we know how important our role is. And, again, we're just trying to, look over a 10 period of time and make sure that we're breaking even. If we lose a little bit this year, we might bump up the contract next year by 2% or something to try to recover some of that. But, again, I know that even Ellen said that we're not trying to, make money here. We're just trying to, to deliver a really good service. And over time, I'm sure it'll flatten out.
I don't know if Ellen or Cheryl had anything that, different perspective from the work that they're doing on that same question.
Yeah, Sarah, so for shared services at TSNE, so say you have a budget, operating budget of 350, we start at 6%. So it's a flat rate. We charge you that same rate throughout the year. So if your budget suddenly goes down or up, we're not going to change it on you in the middle of the year. We might reassess contract renewal time to see, where things are at. I will say, again, we're still learning a lot. TSNE is a very established organization, but we're kind of like a startup within an established organization. So there's a lot of learning. And one thing we've been thinking about is, I know that some organizations also use a rubric around level of effort, quote unquote. So like how many grants, right? How many contracts, how many employees does an organization have? So we don't do that currently for financial services. We're still kind of assessing and looking at, what is the team capacity, internally, and sort of the level of effort. Because sometimes, a larger organization, they might actually have, fewer grants, for example, right? So just because you have a smaller budget, it doesn't mean there's necessarily a less level of effort, but that's talking about the organization's bottom line, like TSNE's bottom line. We started with a sliding scale to try to address this work in a more equitable way, right, for organizations. So again, this is what we're going with for now. And then again, for the HR services, we do use both the budget and the number of employees within an organization.
Thanks, Ellen. Beth, I see you had a question. Kind of switching gears a little bit. I'd love to hear if you wanted to ask the question and expand on it a little bit.
Sure. So very interesting organizational structure. So we have at Prevention Works, we have a fiscal agent, the collaborative is our fiscal agent. So I'm familiar with the shared services model, but how does this model work with a board of directors? So I know nonprofits have boards of directors and incorporate and all kinds of things like that. I'm curious as to how what your board looks like and how it's structured. Just curious.
That's a great question. I don't know if Cheryl or Elizabeth want to take that question.
So we have a board, obviously, and then all of the agencies that we perform the work for have their own boards, and they all have their own executive directors. So we don't obviously make operational decisions for them. We don't decide how they spend their money. We're just reporting the results. We're just sort of the back end office for them. And then Aris has a couple of other divisions as well. We're also the fiscal management services organization for the state of Vermont through Medicaid. And we also are in 30 different states for veteran self-direction. We do their payroll as well. So we do have some other divisions. Our board is made up of our board, based on our bylaws back from 1996, our board is made up of only board members from the agencies that we do the work for. So we have not been able to incorporate any board members for the FEA or the Veterans Division due to our bylaws and the current board structure not wanting to change it. So yes, our board is made up of our agency directors, but again, or board members, but it is a separate board than the agencies. They have their own. I hope that answers the question.
Yeah. Cheryl, talk a little bit about your board.
You were set up very similar. VANC has 10 board members. Each of the 5 AAA's executive directors are a board member, and then each of them are allowed to bring one of their board members to the table. So we have 10, and then each agency gets to have, again, the executive director plus one of their specific board members.
Great. Thanks, Cheryl. Christina, I see you have a question about first steps. Kind of how do you dive into this? What does that look like? And I'm going to direct that to Cheryl, but if you wanted to expand on that, that'd be, a little bit about your question, but I'm going to direct it to Cheryl just because that's where she is. But I will offer the opportunity for others to step in. So Cheryl, Christina, I don't know if you wanted to just frame the question a little bit.
That captures it. I mean, we've got a group of people group of organizations who are like, okay, we want to do this. How do we proceed?
Well, I think it's really
Cheryl.
important to define your mission, exactly what you want to do, and create that mission and business structure. Create an agreement in your bylaws. And once you have that structure and you have your employee or employees, someone needs to really facilitate those initiatives. And that's what I'm doing. Go after the low-hanging fruit. We always say build our infrastructure first, but also go after the low-hanging fruit. There's so much pooled cost savings to be had in just vendor contracts, and they're really, really easy to obtain. So that money comes right back into your organization or is passed through to your clients. So again, low-hanging, go after your healthcare, go after your office supplies, your phone systems, your computer systems. That's all great areas to save money. And you're doing that while you're setting up your infrastructure, setting up your, whether it's nonprofit or you can do all this work as you're building the foundation with your bylaws, your affiliation, your or your whole business structure. And then, continue. We have a lot of conversations with our executive directors on board. They're very, very active. So we continue to revise those initiatives. I work very closely with our staff as well. So I create staff groups to help facilitate change. And change management is very critical in this part. So getting the buy-in from staff and alleviating fear is a really good place to start early on in the conversations. And then it just, again, you continue to build. The back office is a very easy place to start. You're working on the accounting, again, the computer technology, everything that, both Ellen and Elizabeth have spoken about as well.
Thanks, Cheryl. That was great. I don't know if Elizabeth or Ellen have any thoughts or, just suggestions for Christina and her group that are kind of thinking about coming together and what that might look like. Any suggestions?
I think Cheryl nailed it.
Awesome. Christina, was that helpful? Awesome.
Yeah, thank you.
Perfect. I see that it looks like Robin had a question about kind of what's working, what are things to look out for, what are some of the kind of, challenges. I don't know if Robin, you wanted to give voice to your question, or if that was a good enough summary.
I just yeah, that was my sort of reason for signing up, was wanting to hear what's working and what should we do more of, I guess.
Yeah, that's a great question. I don't know if Elizabeth or Cheryl want to kind of talk about your what's working, or Alan. I can call on one of you if you'd like. Elizabeth, thank you.
Um, it's working. I think that, I came into Aris 5 years ago and it had already been set up. Everything was already in place. We had all the staff here to pull this off. So I was really kind of taking over the program and making sure that I continued to make it work. I think for us, the biggest struggle is with, all the agencies that we help are funded through Medicaid. So if there's a significant change through Medicaid, then we're responsible for 5 or 6 different agencies, and we are a small organization. And so it just takes an enormous amount of work to get over the humps of, any of the changes that are occurring. I would say, I wouldn't say that that's not working. It's just, it makes us work harder, because our back end office does what we do to, like I said, allow the agencies to really focus on the services they provide. It is up to us to take care of those things for them so they don't have to worry about it. And we take a lot of pride in doing that. So if we have to work a little extra or figure things out, at least we're only figuring it out once, and then we're able to, do the work for all of our agencies so that they're not each trying to solve the same problems for themselves. So again, I think that works as well. When we're answering questions, we can answer all 5 agencies at the same time, which is, again, a huge savings to them. So I don't think that there's anything that's not working. It's just that sometimes we get a little bit overworked because we're solving the same problem for all the agencies at the same time. And there's always a deadline.
Of course, there's always a deadline, Elizabeth.
Yeah.
That's part of the work.
I think actually when I stepped into this role we had 11 agencies, and I had to file PPP applications to get them to turn from loans to grants. And I think I had until the end of the year, and I started in October. And so, yeah, that was kind of a big lift. But
yeah, that's huge.
That was a big lift.
Yeah. No, thank you for that. I think that was
Yeah.
insightful. I don't know, Cheryl or Ellen, if you had anything to add, kind of what's working from your end or what you see. Thank you, Ellen.
I can jump in real quick. So again, we just launched in August of last year, and we think it's working in that, our first 2 clients just renewed their contracts with us. So I think hopefully that's evidence that, what we offer is a value add. I think what's not working is this is like a very uncertain time for nonprofits, right? What's not working is the current administration's perspective on nonprofits, on the landscape, not to get into politics, though I would argue that all of the work that we do is political, right? So I think that is really challenging as a nonprofit who is just trying to break even. Like, we're not in it for, the sake of, trying to make a profit here. But as a fee-for-service program, it's a scary time, right? So we are only as useful as we can be if folks are actually able to afford us. And before I joined TSNE, I worked in philanthropy, where we funded organizations across New England. And I have seen time and again, scrappy nonprofits, very grassroots, just small organizations. Like, when they funding is decreased, what they're focusing on is keeping the lights on, right? So they might go back to their board member who's a volunteer accountant for them, who will provide services free of charge. I've seen that. I had former organizations that I work with in a funding capacity who lost their C3 status because the financial infrastructure in their organization was really lacking. So it's just an uncertain time for a lot of our clients, and I would say like the TSNE, we're a big organization, and we're still being impacted as well.
Yeah, I think I would say, looking at everybody on here, we would all agree that the administration's perspective on nonprofits is huge, huge problem for all of us, in multiple different ways. So thank you for raising that up. I mean, I think that's part of the reason we're here, right? Is to think about and creatively, like, how do we build resilience together? Like, what does that look like? And how do we actually do that? I don't know, Cheryl, if you had anything you wanted to just kind of, in terms of your success, failures, things to learn from.
Sure. Again, I'm going to mention the change management. It's such a critical part of this establishing a new network. We all have this idea of going out and creating a back office business to help our agencies, and that's fairly easy. But we have to remember that it's not easy for a lot of the staff. It's a big, scary, it seems like merging. There's a lot of unknowns to them as we're building the runway. So change management is critical, and I think we've been very successful with that. And again, I mentioned the staff work groups. Not only has that helped us with change management, but it's also been a great foundation of brainstorming. These are the individuals that are doing the work. So it's made a really big difference on helping us guide what types of technology systems are needed, what's working well for them, what's not working well for them, and that really helps guide the ways that that VANC can support them as we're creating the infrastructure. What's not working well? I think lightly said, you have to be prepared to do a lot of work. Especially if you are the only one wearing many hats to get the initiative started. So be prepared if you're going to start this up. Make sure you have the resources and the support. I'm very fortunate that I have such great support from the executive directors and the board members. But without that, would be this position would be very difficult.
Thank you, Cheryl. No, I think yes, the work is I think that's been said across all three of our experts. There's like a high level of work that's needed to keep to start and to kind of push things forward. And I just want to underscore and kind of hold up the staff working groups. I mean, that's one of those kind of practices that I've always been really intrigued by when listening to you talk about the work, Cheryl. And I think that is a little bit unique in all the different shared service providers that I've talked to. So something to just kind of highlight and think about as for anybody who's thinking about kind of starting this model, that piece of the work has been, I think, contributed. And you've talked about this in other conversations, Cheryl, that this has kind of contributed to some of the successes that you've been able to have. Is those conversations, while hard, are really helping to build that trust that's really needed and build the relationships that's really needed to kind of counter some of the narrative that might be negative as you move forward. So
Absolutely.
Thank you for that. I see, Sarah, you have a great question that I was going to ask. So I don't know if you wanted to just ask the question across all of our panelists. There's no, it's a good question about kind of, and one that keeps coming up is, both for Aris and for VANC, they are similar organizations, similar missions, similar funding sources, different sizes, different capacities, but similar in their kind of base. Whereas Ellen, you're working with organizations that are different, right? Like, and have different kind of funding models. And Dave, I think you had a question similar about kind of that, how do you work with and across and think about kind of how you charge, how you create that kind of business model when you have a variety of different organizations at different capacities and different funding mechanisms, right? So talk a little bit about kind of, pros and cons to how you might think about bringing together organizations to kind of start to share services. So did I accurately say that, or do you want to add something to
Perfect.
change,
Perfect.
edit?
Thank you.
Yeah.
Thanks.
So I don't know, Ellen or Cheryl, I mean, they're very different models.
Mhm. Yeah, thanks for that question, Sarah. This is something I think a lot about, even just in our, initial sort of pilot group of clients. On paper, they may look the same, but in reality, working with them proves to be, uh, very different, right? I think this is something that is top of mind for me. A lot of our processes in large organizations, working, say, with fiscally sponsored organizations, across the country. I think TSNE, we work with 50 fiscally sponsored projects across the organization. So as an organization, we're very efficient in many ways, and things have been processes, systems, procedures, what have you, have really been designed for scale, right? And so, as a new service line, working with organizations in a slightly different kind of way, I think I've been sort of like the new kid on the block who's not super popular at times, because I'll say, well, this one size fits all approach is not working for some of the organizations that we're, working with, right? So for one example, I'll give you is a Wampanoag serving organization that's located in Martha's Vineyard. So they, most organizations go by a biweekly pay schedule, right? So that's how TSNE pays staff internally. All of our fiscally sponsored projects were all on the same biweekly pay schedule. And the ED said, is there any way you can do a weekly pay schedule for us? Because on the vineyard, our community really experiences underemployment. So the folks that we work with actually cannot afford to be paid on a biweekly basis, right? So I brought this to, our payroll staff, who said, do you know how much work that will add to our plate? And I said, absolutely. And I'm willing to bet this is not the only organization that might need a weekly pay schedule. So let's try it, right? At the end of the day, we're not going to be able to be everything to everyone. But, given that we're a startup, in some ways, let's see what's feasible for our organizations in the name of equity, right? So yeah, it's much easier to do just a one size fits all approach, but that's not the reality of, many of our organizations and kind of where they're at.
Thank you, Ellen. That was a really good example. I mean, I know that this question of how, in the state of Vermont, there are multiple umbrella organizations or organizations that have come together that are either have been providing some sort of shared service, ranging from like kind of advocacy, right, which is kind of the kind of an easy baseline, all the way through something like VANC and Aris, where it's kind of much more like that is the purpose of those organizations. But they're all that I know of, at least across the state, ones of similar organizations coming together. And so, but there's a call for a lot of the smaller organizations that are more grassroots, where there might be efficiencies that people are looking for and or purchase power for some healthcare, right? Like these are things that are coming up much more frequently now. And so how do we do that? What does that look like? How do we create models that would work? And so I think, and I know, Sarah, I know that is something that you're struggling with right now. I mean, so I think, listening to that example really is helpful to kind of help think through Yeah, I don't know if Cheryl or Elizabeth, if you had anything you wanted to add to that question. I mean, you're both from organizations that are similar. I mean, there's probably challenges even within similar organizations because capacity isn't necessarily the same, even if they're similar organizations, and right. So I don't know if you had anything you wanted to add, just thoughts from your experience. It's okay if no, that's fine.
Yeah, I mean, there's certainly, even though we're doing the same work, of course, there's some difficulties within working with each of the agencies. And again, I think it's important to have that relationship, a very close relationship with the executive directors and the staff, and help work through. Again, a lot of it comes down to change management.
Mhm.
And usually we're able to find a solution that works for everyone.
Mhm.
Occasionally it takes a little bit more effort. But I think the affiliation agreements and the bylaws that were put forth really help define how we resolve issues if needed to go to that level, but we haven't needed to do that at this point. So I think we've been very successful in working together and building our infrastructure. We may, at some point, once we get really established with the AAAs, we may actually bring in other affiliates as well.
That's great. Thank you. Any other questions for our amazing and amazing experts? Sarah, I see.
Sorry, I don't mean to be dominating, but I do. I've got lots of questions, and this is just so interesting. Thank you. Cheryl, I wonder if you could talk a little bit more about those small groups. And I'm sorry if I missed something in your initial description, but can you talk about, those groups that are across organization and what their focus is and how often they meet and that sort of thing?
Sure. When I first came on in May of 24, the executive directors had really laid out some initiatives they wanted to focus on. HR was one of them, bringing in health insurance and HRIS systems, payroll and such under VANC. Accounting, bringing technology was a big area, and actually that was one of the areas that I think we found great success in the groups. We also had received 2 grants that were really focused on technology and our infrastructure build. So one of the issues that we commonly have is that we have 5 agencies. They're all doing the same work, but they're all on different accounting systems, technology systems, program software. So I created multiple work groups and really started at the basis. What's the foundation? What's the network? Many of them are still on old, big servers in the closet. So initially I created a small IT team. So it was 1 or 2 individuals from each of the AAAs, and I met with them biweekly. It's now much more once a month or so. But we really did a lot of research together. We did a lot of brainstorming. What would really help the AAAs? How would it help with the network? And what we established is that we could easily bring everybody under one cloud network and save hundreds of thousands of dollars doing that. And that is just one example of where those team members, those staff members that are the IT staff members are telling us this is what's working, isn't working. And we're continuing that. We have a second grant from the ACL, which is actually helping us build that network right now. So we're putting everybody on one cloud network, as I mentioned. That'll make it very easy for us to exchange files and create standardizations. We're able to do group purchases on laptops, on any sort of hardware and software. Software is a very big cost savings when you can buy software together. And the second phase of this grant is we're actually bringing our Vermont Senior Helpline all under VANC into a VoIP system under Microsoft Teams. Again, hundreds of $1,000s of savings, getting it off the old infrastructure. And this was all created within these work groups. I did a lot of research as well. I have a lot of background in technology as well. But, facilitating those brainstorming sessions, it really, helped us move forward with what's the foundation? The foundation is our network. And so everything since then has been building. We have a data science team So how do we standardize our data? How do we standardize our programs, our actual software for our business case software? How do we standardize that so that we're able to report out all across the state? And again, that data team is really, really working on that. Okay, if you put in a person's name and it's slightly different from one agency to the other, you're not going to get a report. So that team is really working well to, okay, this is what we need to do to standardize that. We have a compliance team. We are working very much so on making sure that we have compliance assessments and a compliance manual. We have a purchasing group team. Again, working on those very basic things of cell phones and office supplies and client assisted devices. And those are, again, really easy areas, making a phone call to a couple of vendors and negotiating new contracts. We have a finance team. We have 5 agencies, again, and 4 of them are on QuickBooks. And it's the desktop version, and it does not have, support. And we're using outside accountants. They're using outside accountants. So we're working on establishing a process so that we can implement a new accounting system across all agencies under VANC. And we'll be working together to say, okay, what is that going to look like? What is the staffing needs? What can we incorporate under VANC that will reduce the cost out to the subcontractors? So again, involving those team members, not only does it helps with the fear factor of change, but it also has been super helpful in motivating them to maybe even in their own personal growth. And sharing expertise across the network has been fantastic. One of the larger agencies may have, a full technology team or a data scientist, whereas one of the small agencies may not. But when we put them all in the same room, they help each other. And by creating this one network, we are able to actually create these files, sharing standardization, sharing ideas in one centralized area. So it feels like we're not so spread apart anymore. It feels like we're very much so helping each other and sharing those services in a great way. And that's where those staff groups work really, really well.
That was great. Thank you so much, Cheryl. So thank you, everybody. I know we're at time, and I appreciate everybody coming and joining us today. A couple of things that I just wanted to note in terms of next steps, I'm going to just share really quick. This is kind of part of a larger series. There's a couple other things that I would want to just point to. We started a collaborative newsletter last month. We will continue to do that this moving forward, just sharing different resources, including the recording of this office hours. We have a group of UVM master's students that did case studies on 5 different collaborations and shared service providers across the state. And those will be presented in the beginning of 2026. We will do another office hours on January 12th. The topic is still TBD, but we will let people know what that topic is once we've kind of honed in on it. And the last thing that I just will kind of as a teaser, there's a group of us that have come together that we're calling CoLab, the Collaborative Laboratory, and we're going to come up with a way to start to share all the incredible resources and tools and templates that we have been gathering over the past year. So be on the lookout in early of 2026 for an announcement of that rollout. And other than that, I want to wish you all a happy holiday season. And thank you so much for joining me today. And I look forward to seeing all of you in January, should you choose.
Thanks.
Thanks, folks.
Thank
Thanks
you.
so
Okay.
much.
Thanks, everyone.
Bye.
Take care.
And thanks to our panelists. We love you.